Every day, you and I get bombarded with negative news. And just like our bodies becomes what we eat, our minds become the information that we consume. If you want to stay positive, it's so important that you also listen to stories that inspires you and uplifts you. In this podcast, we interview world-leading experts dedicated to solving the world's most pressing problems. And if you stick around, I promise you will not only be as informed as if you watch the news, you will feel uplifted, inspired, and have more positive energy in your life. Welcome to Great.com Talks with. Hi and welcome. Today Great.com talks with Imran Khan, who is the Director of Program and Strategy and Development from Sightsavers.org. And if you haven't heard of Sightsavers before, they're an organization that is protecting eyesight and fighting for disability rights all over the world. And if you haven't done so before, you definitely want to press subscribe on YouTube or in your podcast app, because today we're going to explore how we can help millions of people to get better eyesights. Imran, thank you so much for taking the time to speak with us today.
Thank you. It's my pleasure.
So, how would you describe Sightsavers for someone that hasn't heard of your organization before?
Well, Sightsavers is an international organization that works in over 30 countries where, as you mentioned, we fight for the prevention of avoidable blindness, as well as to ensure people with disabilities have equal access and equal participation within the world.
When I started reading up about different charity inventions and I read about the problems that surrounded blindness and how treatable it is, I was kind of shocked. But could you maybe paint a picture of what the problem looks like worldwide?
Sure. Yeah, and when we think about the problem that we're trying to solve at Sightsavers, it really reminds me of when I was a student in optometry school about 2 decades ago, when I had the opportunity to participate in an eye care mission in the Petén region of northern Guatemala. And when we attended these clinics and when we set up clinics, I was always shocked to see hundreds and hundreds of people waiting outside the clinic to have their eyes checked. Many of these people had walked several days to come and get checked and get treatment. And what I was really surprised by was the number of people whose vision could be improved, could be treated with a very simple pair of glasses or a simple cataract surgery. And especially for me, having worn glasses since I was 10 years old, it was even that much more shocking for me, having come from a background where, I did have access to eye examinations. I did have access to affordable quality spectacles. And because of that, I was able to keep moving in my education and have the opportunities that I have today. But what was startling to see was the number of children who were attending those clinics who have never seen a pair of glasses, let alone knowing the benefit of how that could help them in their schoolwork. So that experience really helped mold my professional life. And I think when we look at the numbers, those communities and those individuals that we saw in Guatemala were just a drop in the bucket compared to the number of people who have poor vision globally. So when we talk about the scope of the problem that we're trying to solve at Sightsavers, we find that over 2.2 billion people have poor vision, and over 1 billion people have vision that could be treated or whose vision loss could be prevented with very simple, straightforward interventions.
Wow, 1 billion people. So are we talking about regular problems like needing glasses then, or is it like diseases? So trachoma, for example, I read about on your website and I've heard the word before, but I'm not sure I understand how it happens or how big that problem is. So maybe you could teach me.
Sure. Yeah. So when we look at the causes of poor vision, that there are several different causes. And many of these causes, so almost half of people globally with poor vision have conditions that can be treated. As you mentioned, some people just need a pair of glasses to help them have normal vision. Other people have conditions like cataract, which is the lens, which is a part of the eye that focuses everything on the back of the eye. That part becomes cloudy. And then when that becomes cloudy, people lose their vision. And that can be treated with a simple, about a 10-15-minute surgical procedure where we take out the opaque lens and replace it with a clear synthetic lens. A condition like trachoma can also be prevented and treated. So trachoma is a condition where people have an infection of their eyelid, and then the eyelashes turn inwards and scrape against the front of the eye, which causes a very painful, slowly blinding condition. So for trachoma, we can, of course, do surgery for people who have active trachoma, but we can also prevent trachoma through environmental changes, use of medication. And trachoma is definitely a condition where Sightsavers is really leading the way with eliminating that condition. So, hopefully in a few years' time, we will no longer have people going needlessly blind because of trachoma. However, conditions like cataract, refractive error, unfortunately, are not going away, and we still need to put our efforts in treating those conditions.
It's so important. It must be so horrible going blind at a young age, and especially if it's preventable. I mean, I imagine myself sometimes, because I'm wearing glasses now as we speak, and if I don't wear them for a couple of hours, I'm starting to get a headache. And I'm wondering, I ask myself the question sometimes, if I was living 300 years ago and didn't have glasses, would I just go around and be tired and have a headache all the time? Or would I kind of adjust? What would happen if I didn't get my glasses? How would it affect my life?
Yeah, that even, it's not just living, 300 years ago, it's also living in, places where Sightsavers works in, sub-Saharan Africa or in countries in Asia where people just do not have access to trained professionals, eye examinations, or glasses. And, I can relate to what you're saying about wearing glasses. I started wearing glasses when I was 10 years old, struggling to see the board at school. And, again, I was lucky enough to be in an environment where I was able to be picked up because of my vision problems. I was able to get an eye examination and a pair of glasses. So, but, for billions of people, we see that they do not have that opportunity to do so, which of course affects their ability to get an education. If you're unable to read or see the board at school, that's going to impact on your education. And people who are out in the working place, if they're unable to work, that's also going to affect their ability to have money to feed their families and save for the future.
It's obviously such a bad thing for society that people are needlessly losing their arguably most important sense. So what is the bottleneck then that prevents everyone from getting the help that they're needing?
Yeah, so I would say that the bottleneck is actually within access to these services. So when we talk about access, that's having enough trained doctors, trained optometrists. It's access to the diagnostic equipment that these doctors would use to examine the eye, as well as it's having the consumables. So it's having the surgical kits, it's having the spectacles, and having those supplies that are both of quality as well as affordable.
Right. And how is Sightsavers then playing a part in the solution? What service are you providing?
Yeah. So the way that Sightsavers works is we believe in a system strengthening approach. So what that means is we look at the entire eye care system whenever we try to support. So Sightsavers trains the surgeons, but at the same time as training the surgeons, we also equip the clinics. So we build operating theaters, refurbish eye units so they're fit for purpose, as well as we supply the consumables, so the glasses, as well as the surgical kits, the intraocular lenses that we put in after cataract surgery. And while we're doing all this work on the ground, we also advocate to government so they will prioritize eye health as a major initiative with countries. So we work both at that, kind of community level, but then we also work at the national and international levels as well.
Okay. So are you then training local surgeons to be able to perform these surgeries, or are you training people you're from the US and then bringing them?
No, so the way that Sightsavers works is we believe in supporting the local capacity. So we only train local surgeons, local healthcare professionals. Yeah, because we believe that in order to ensure the sustainability, so in order to ensure that these services are provided after Sightsavers support ends, that we want to make sure that those services stay in the country. So we work with our government partners to ensure that the clinics are handed over to government, or they're actually government clinics. So we're supporting the government system itself and training locals to both manage the clinics as well as perform the eye exams.
Right. Yeah, that seems like a stable and sustainable approach. Now, I can imagine then that being in any healthcare field must be challenging in COVID-19 times. So how has the pandemic affected your ability to help people with their eye health?
Yeah, so COVID has been very disruptive to providing services, because of course, as we know, many of the hospitals have been focused really on the COVID response, as well as Sightsavers carries out a lot of school health programs where we actually go into schools, provide the eye screening, and provide glasses. And of course, with schools being closed, we are unable to provide those necessary services. So what that means is that a number of, thousands of critical surgeries have had to be canceled, which leave people in quite a vulnerable situation during the pandemic, and there's an increased backlog of those people who needed eye care. However, what Sightsavers has been able to do is that we have been able to address some of the direct challenges in COVID. An example of this is a project that we're doing in Nigeria that's funded by the UK government, where we were able to use some of our approaches that we learned within making our own eye clinics accessible for people with disabilities, to work with COVID response centers to ensure that those centers who are specifically looking at treating people with COVID are accessible for people with disabilities. So we were able to use our learning and help use the learning we have from eye health work to help the broader COVID response, as well as in our neglected tropical disease work, where we do a lot of behavior change. So we were able to use those platforms where we communicate behavior change around preventing conditions like trachoma, to help also spread some of the messaging around COVID, around washing hands, around social distancing. So we were able to also use some of those platforms to help address some of the challenges with COVID.
Okay, so you already had an infrastructure, influence, community, and then you could use that as a way to prevent the negative effects. That's interesting. You mentioned neglected tropical diseases. How are you also, which ones are you working on, and how is that work?
Yes, so you had mentioned trachoma, our trachoma work.
Mm-hmm.
We're also working on river blindness as well. And our approach with our neglected tropical disease work is that we believe in an integrated way of delivering these treatments. So what that means is we will look where we can package up different interventions together. And we not only do that with our neglected tropical disease work, we also do that within our eye health work as well. So a good example of this is the school-based programs that I had mentioned, where we go into the schools working with the education departments, where we deliver not only vision screening, but also deworming medications as well.
Nice.
So using that common platform of the school as a foundation where we can deliver both neglected tropical disease medications as well as glasses at the same time.
Yeah, that must make the efficiency of what you guys do much higher. So what was the river disease? I hadn't heard of it before. How does that work?
Yeah, so with it's got a very complicated name called onchocerciasis. And what that is it's these parasites that cause an inflammation within the eye.
Okay.
The way that we prevent that is through medication. So we can treat people who have river blindness, but really the goal is to prevent people from developing river blindness through controlling the parasite that's causing it. So, and that's a bit of how Sightsavers works. Is we work across the spectrum, both working at the level of prevention, but also working at the level of treatment. And for those who are irreversibly blind, so these are people who have been caught too late by the system, we also ensure that they have access to the rehabilitation and are able to have the support they need.
So you said you were working in Guatemala, did you say 20 years ago?
Yes, this is 20 years.
20 years. Okay, so you've been around for a while. I thought Sightsavers has been around since the 1950s. So how has the situation globally developed and progressed since then? And where are we going?
Yeah, so I think when we look back at in the last few decades, what we've really seen is a concerted effort to address these causes of poor vision. And because of that, we are seeing within our lifetimes the end of conditions like trachoma. So trachoma will be eliminated thanks to, well, not only Sightsavers, but also a global effort to really target this condition. So we're seeing some really good news about what happens when people work together. When I say people, that's organizations like Sightsavers, as well as large global institutions, as well as the private sector, the pharmaceutical companies, and the ministries of health within the countries we work in. So definitely a good news story. However, we are still seeing conditions like cataracts, for example, increasing. And within the next few decades, so it's projected that the number of blind people will increase 3 times by 2050.
Wow.
And that's due to several different factors. One factor is that we're looking at an aging population. So as people get older, they start developing some of these conditions like cataract, like diabetes and the complications of diabetes in the eye, like glaucoma. So as an aging population, we are seeing increase in the number of people who will become blind. On top of that, we're seeing lifestyle changes. As people develop, move from rural settings to more urban settings, and there's more of a sedentary lifestyle, that we are seeing chronic diseases on the increase. So diseases like diabetes that can also cause blindness, and in fact is the leading cause of blindness in the working age population. We're seeing huge increases in those conditions. So even though we have good news with some conditions like trachoma, which will be eliminated, we are seeing other conditions like diabetes on the rise.
So I feel excited to somehow be involved in helping out with these diseases, because it's quite cheap to help someone, from the way I understand it. So if someone is listening to this and they want to do something to support maybe your organization or in any other way to help treat people's eye conditions, what can they do to help and to stay up to date with Sightsavers?
Yeah, so I would recommend that people log on to our website. So it's sightsavers.org. And there you can learn all about Sightsavers' work in detail, learn about the projects that we're doing, learn about the research that we're conducting, and learn about our advocacy efforts as well. And then from there, you can donate to Sightsavers to help us really on our journey to eliminate avoidable blindness. And as you had mentioned, that we know what the solutions are, and they are very affordable. That it's around $40 for a cataract surgery, about $5 for a pair of spectacles. So definitely affordable.
Mm. We have come to the end of our interview. Imran, thank you so much for taking the time to speak with Great.com today. I felt like I learned a lot about eye health and how the situation looks globally.
Great. Thank you very much, and appreciate your time and appreciate your enthusiasm. And together, I'm sure that we can find a solution to make sure that people globally have better vision. Thank you so much.
Thank you. I believe you're right. And for you listening, if you enjoy this conversation and you want to help us out to spread this message so more people can hear conversations like this, press subscribe on YouTube or in your podcast app. That will show the algorithms that this conversation is important. And it's a little vote from your side for a future with better eye health. Thank you so much for listening, and we see you in the next episode.